PLAB 2 preparation with Dr. Al. Because I like to spice things up, I'm gonna read to you guys a couple of questions that I got asked by someone. So this person actually screenshotted the NICE's guideline about diagnosis of asthma and told me, do I have to speak about eosinophil, FeNO, spirometry, PEF, all of them? No, you don't have time. You only have 4 minutes. You want advice. You want to be able to manage the small bits. You want referrals. You're gonna refer the patient to an asthma clinic whereby they will do the investigation needed to confirm the diagnosis. That's the only thing you have to do. You do need to know them just in case the patient might ask, investigations like what, doctor? Do you have to explain what is the meaning of FeNO? No, you don't have to dive through all of that. Well, you have to do bloods, that's for sure, because that's your level. FeNO is done somewhere else. Spirometry is done somewhere else. Not even in a normal GP clinic they'll be done. They'll be done in the asthma clinic. I'm someone who is asthma. Ask me about this. And then if the FeNO is not available, they will either send for spirometry, or if the spirometry is not available, they'll send for PEF. That's not your job. You'll just refer to asthma clinic and then they will sort things out. You have to give advice about allergens, triggers, inhalers, seniors if you find things unreasonable, bloods because obviously this is very important. If you feel indication for chest x-ray, then a chest x-ray, and that's it. The other question I got from the same person is, why don't we ask about recent surgery or pain in the gulls in asthma? Guys, I know that shortness of breath is a little bit confusing, and when you have a patient with shortness of breath, it could be similar to PE because they're both called shortness of breath. But remember, when you auscultate the chest in PE, you're not gonna hear wheeze. When you auscultate the chest in asthma, you're gonna hear wheeze. My advice in shortness of breath, try to get to the examination bit quickly so you will be able to know what you're going to listen and diverse your questions about that. It's fine if you examined the patient earlier on before you finished the history and then went back and asked some question. So, all right, I explored shortness of breath. Do you mind if I just listen quickly to your chest, especially in shortness of breath and in derm stations? You can say, do you mind if I take a look? All right, I listened to the chest, I heard wheeze. So now I know what I'm dealing with. It's asthma or COPD. I didn't hear anything. Okay, I need to ask more questions to